Hi YouTube, Beautiful Evolution back. Again, I just wanted to do another update and answer a question that I have gotten a number of times about pregnancy after VSG, especially pregnancy so soon after VSG. So you all know that my surgery, or for those of you that don't know, my surgery was on April 18th, 2012. And I had the VSG surgery. It's like a glare in here. I had VSG surgery April 18th. My highest weight was 300 pounds. I was 289 on the date of surgery. As of yesterday, I was 237. Yesterday, I was like, that put me like 19 and a half weeks out, 14 weeks pregnant. So I've been getting a lot of questions about, my doctor's concerns, nutrition concerns, what is everybody saying? And rightfully so, because I would be really concerned about that, and I was very concerned about that as well. So when I found out that I was pregnant, I went directly to my surgeon's office. No, actually I went, of course, to my obstetrician first. And then I went to my surgeon's office the very next day. I spoke with my nutritionist. I spoke with my surgeon directly. And they did a regular kind of follow-up thing, basically checked my weight, how much weight had I lost in the time. At that time I was, I don't know, maybe less than 3 months out. So they did the checkup and everything like that. And, everything was good. Nutritionist did give me a list of some things that I should and should not eat. Just pregnancy stuff like hot dogs and lunch meat and what fish to avoid and, no sushi, that kind of stuff. Other than that, she told me that I should continue with my protein, try to focus on protein the most, that I should try to get a shake in a day, which I've been unsuccessful with. I can't do a shake. I just can't do a shake. So, not like a powder shake, but I can do like, I do like smoothies that I make at home with, with like yogurt and peach nectar or frozen fruit and stuff like that. My surgeon said that he wasn't very surprised and that I shouldn't be concerned or, too nervous. He was actually really laid back and just said basically, that you will continue to lose weight and, just to keep up with the obstetrician, let him know if I had any questions or if I had any concerns. And actually, my surgeon's office works out of the same hospital as my obstetrician. There were two surgeons that did my surgery. So actually, there was a woman and a man. The woman who was there the day of my surgery and assisted the main surgeon deliver her baby with my obstetrician's office. It's a group practice. So, they trust each other. Everything was basically fine. They kind of shared notes and everything like that. And I've been fine. I did have to go to have ultrasounds done early. One to test to find out how far along I was. One because they thought that I was having a miscarriage at about 6 weeks when my hormones were low. But I wasn't. And then they wanted to see how far along I was. And, so everything went well with that. And that's basically been it. I have a main obstetrician. And then I'll go to the hospital for my ultrasounds. And they are a high-risk pregnancy team. And they're a group practice as well. My main obstetrician said that, there's a lot of things that they consider when they say high risk. So some doctors would say any plus size woman is high risk. Some would say that I was high risk because I was soon out of surgery. They would say I was high risk because I've had surgery before. So, they just want to check on the baby and make sure everything is fine. And I have been losing weight, so they just want to always keep an eye and make sure that everything's fine. So they do the Doppler when I go to the doctor, and like I said, I've had the ultrasounds, but really it's basically progressing normally. The main concern that the high risk doctor shared with me, which was based on her knowledge of gastric bypass and not the sleeve, was internal herniation. And I know that a lot of people do develop hernias. I have to have hernias removed after gastric bypass. I've known 3 or 4 people personally who've had to have it done. So they do have a concern, and once the baby starts to grow and everything kind of starts moving around in there, they think that I'm at more risk to suffer from a hernia. The other things that they discussed with me were plus size pregnancy issues like preeclampsia, gestational diabetes. Being plus size, they think that you'll have a bigger baby, might lead to having to have a C-section. You might be in labor longer. All of that kind of stuff. So all of that stuff is, stuff that you can develop plus size or not. And speaking with my surgeon, my bariatric surgeon, he's just basically like, yeah, it's healthier for you to become pregnant actually smaller than it is if you had started out at 300 pounds and become pregnant. So he's less concerned. And my main obstetrician is less concerned. But the high risk doctor did tell me about internal herniation. She was a little more dramatic for my taste, I guess. I just thought that, it's her job to alert me to what I could experience. But I felt that she was just a little bit negative, I guess. And it might be just my opinion, but I felt that she was just a little bit negative, But she did let me know that, I had these certain risks, that because I had had surgery, that they consider my pregnancy to be a high risk pregnancy, so that they would monitor me after my 20-week ultrasound, which is like the anatomy, and I'll find out what I'm having. Then every 4 weeks I'll have an ultrasound just to keep an eye on the baby. So for you guys who've been pregnant before, anybody, whatever, you probably get 2 or 3 ultrasounds, period, in your pregnancy. So I've had 3 already, 4, and if I'm measuring it right, it might come out to about 8. Which is okay with me. That's a part of finding out and making sure that everything's fine and everything is well. And I guess because I've been so nervous and just whatever, I'm happy every time I go to have an ultrasound. I see my baby is still there and bigger than before and developing and everything like that. So that's that. Just a quick 1-2 on what's going on. A quick 1-2 on what the doctors are saying, because a lot of people have been asking me. They aren't really saying too much. They're not as concerned as you would think that they would be. I still, of course, suggest that you wait to become pregnant, because it is traumatic on your body. And it's been traumatic on my body. Really, it really has been traumatic on my body. But, once it happens, it happens. And we kind of take it from here. And that's what we're doing. So, stay up. Any more questions, anything else you want to know, just shoot me a message or leave a comment. Thanks so much for watching, and I'll talk to you guys later.